Good afternoon, everyone. I hope that you're having a safe and peaceful holiday with your families. I'm joined today in person and remotely by men and women who are on the front lines running our hospitals across Illinois. Those for whom the pandemic has been made so much worse, with so many unvaccinated people seeking life-saving care, which too often ends in tragic deaths. My deepest thanks to Alan Spooner, President and CEO of Franciscan Health South, who's here with us in person today, Rex Budde, the President and CEO of Southern Illinois Health, who's here virtually, and you'll hear from him a little later, and Colleen Kennedy, the CEO of the Carl Broman Medical Center in Bloomington and Carl Eureka. I appreciate all of these healthcare leaders for taking time away from their families during the holidays and for the work that their nurses and doctors and staff are doing. Normally, this is a somewhat restful time of year, a time for the comfort of being with our loved ones, a time for reflection, and a time to give our best to our communities. But I'm here today because once again, this pandemic is surging and threatening the health of Illinoisans. And I'm here to ask everyone to do their part and to give an update to you all on new resources that the state is providing in this fight. First, get your vaccination, get your booster, wear your mask. We're also providing even more convenient options for a booster shot, and we have expanded testing. Today, we're announcing that in addition to the mobile sites that we launched 2 weeks ago, we're surging boosters and vaccination clinics across the state to meet the increased demand driven by the Omicron variant. To get more shots in arms, we are coordinating with local health departments, expanding capacity by assisting them with surge staffing to help administer the vaccinations. We are more than doubling personnel by adding at least 100 people to regional sites, administering vaccinations, preparing vaccine doses for clinic personnel, and doing data entry. This surge staffing will allow our state to vaccinate and boost tens of thousands more every day. After the tremendous success of our pop-up sites in Cook County, administering 7,000 vaccinations in just 2 days, we plan to expand on this success throughout the entire state. Since vaccinations became available, every week we have been operating thousands of mobile sites around the state and have operated 5,500 already. If your organization would like to host a vaccine clinic, please visit our website at dph.illinois.gov/COVID-19/vaccination clinics. We're also increasing our community-based testing by 50% from 4 days a week to 6 days a week. Tests are free and available to anyone. In the coming days, we will also provide additional support to some local health departments around the state to increase their testing capacity and availability. And of course, for many weeks now, we've been providing staffing expansion options to hospitals across Illinois and distributing monoclonal antibodies, antiviral pills, and any treatments or personal protective equipment communities may need. I want to be clear that I'm going to continue to do everything possible to protect all of the people of our state, whatever your vaccine status. But what kind of year 2022 turns out to be depends on all of us doing what is best for all of us. If you are unvaccinated and you get very sick, you'll be filling a bed that would have been available for your ailing spouse, or your parent, or your child, or someone else's child, someone with cancer, or a heart attack, or seriously injured in a car accident. If we are forced to move to a crisis standard of care in our hospitals, it will be because massive numbers of unvaccinated people chose to let others go without quality care. and even more people will die. If you are choosing not to be vaccinated for some non-medical reason, please change your mind. Do it for your family, or for the family next door, or for the people in your community who just need your help. Do it for the nurses or the physician assistants who are overwhelmed and who can't go on like this forever. They deserve better. And with that, I'd like to turn it over to Dr. Izzy. Doctor.
Good afternoon. Happy holidays to everyone. This is a difficult holiday season, especially for the family and friends of the 27,435 people here in Illinois who have died of COVID in Illinois during this pandemic. But we don't have to continue to lose people. We are not in the same place that we were at the beginning of this pandemic or even a year ago. We have a vaccine. We have a vaccine that's highly effective, and it can prevent severe illness and death if we take advantage of this effective tool. Yes, I know there are people who will argue and push back and say, oh, but we're seeing breakthrough cases. Oh, we're seeing breakthrough hospitalizations, so why get vaccinated? Admittedly, nothing is 100%. No vaccine is 100%. But if you can significantly, drastically reduce your chance of being hospitalized or dying, why wouldn't you avail yourself of that opportunity? Listen, let's be clear. Every single event being held during this holiday season will have one or two uninvited, unwanted guests, Delta and or Omicron. One or both could be there. And I'm not saying this to scare, I'm just saying this for people to be aware. But how we entertain that guest depends on us. If everyone's wearing masks, you may not have to take that virus home. If you are boosted, you have a much lower chance of being significantly ill. So as the cases are increasing, I am glad to see that there is a demand for booster doses. And as the governor mentioned, we are working hard to increase vaccination opportunities to meet that demand. So for those of you who are looking for those boosters, keep at it. You will get your booster, and it is critically important for those of you who have not gotten a single dose to get that immediately. Right now, we're absolutely seeing the highest surge in cases from across the entire pandemic for the last 2 years. We had over 21,000 new cases reported from December 24th. It's the highest for the entire pandemic. But it's not just about cases. If it was just cases and no one was ending up in the hospital, then let the cases be. But we saw just in the last 24 hours the number of COVID patients in the hospital increase by a net of 330. There were almost 500 new admits. Of course, some people were released, but a net increase of 330. As we talk about new cases, people may be following those numbers closely, and I want to tell you that you'll see some fluctuations as there are delays in reporting because of the holidays, and so you'll probably see an even higher kind of eye-popping total that will surpass all other numbers because it's a mix of different days coming in from the holidays. But the bottom line is the same. The cases are trending up as well as the hospitalizations. It continues to be the case that the vast majority of cases, hospitalizations, and deaths are among those who are not vaccinated. COVID can be prevented through vaccination. Testing is another critical tool in our toolbox to slow further spread of the virus and its variants. And as the governor mentioned, we are ramping up those efforts by expanding the hours and the days at our community-based testing sites around the state. Please check our website to see the days and times that those community-based testing sites are available for you. Testing is critical, but let's be clear, testing is not detection. Testing in itself is not protection. To get protected, you get vaccinated, you get boosted. And if you don't want to do it to protect yourself from hospitalization and death, can you do it to protect others? Can we do it as a sign of respect for the men and women in our hospitals and our healthcare systems who are overwhelmed and exhausted? While I was trying to get last-minute presents for people in my family, I remember that there are people in the emergency room and in the hospitals tending to new COVID patients as well as non-COVID patients. And they are there to serve us while we are enjoying our families. We owe them a break. Let's prevent the preventable hospitalizations. The bottom line, I'm going to keep it simple, just keep it 100. Get vaccinated, get boosted, stay masked, get tested. And now I'll summarize in Spanish. Buenos tardes y felices fiestas. Sé que estas son unas fiestas difíciles, especialmente para los familiares y amigos de las 27,435 personas que han muerto de COVID en Illinois durante esta pandemia. Pero no tenemos que seguir perdiendo gente. Tenemos una vacuna que es muy eficaz para prevenir enfermedades graves y las muertes. Hay personas que argumentan que estamos viendo casos de avance, hospitalizaciones y muertes, así que ¿por qué vacunarse? Es cierto que ninguna vacuna es 100% efectiva, pero si se puede reducir drásticamente la posibilidad de ser hospitalizado, o peor aún, de morir, ¿por qué no hacerlo? En todos los eventos que se celebren durante estas fiestas, habrá uno o dos invitados no deseados. Se llaman Delta y Omicron. Uno, sonó los dos, estará allí. No digo esto para asustarlos, lo digo para que la gente se dé cuenta. Como los casos de Omicron están aumentando, estamos viendo una demanda de dosis de refuerzo. El Estado está trabajando para aumentar las oportunidades de vacunación para satisfacer esas demandas. Sin embargo, es muy importante que aquellos que aún no han recibido ni una sola dosis de la vacuna se vacunen y pronto. En este momento, Illinois está viendo el aumento más alto de casos de toda la pandemia. Informamos de un aumento de casi 21,000 casos por el 24 de diciembre. Es posible que veamos una caída en los números en los próximos días, ya que los informes se retrasan por el fin de semana festivo y luego un total de un día aún más alto cuando los informes se pongan al día. Pero el resultado final es que los casos tienden a aumentar. La gran mayoría de los casos, las hospitalizaciones y las muertes aún se encuentran entre los que no están vacunados. Pero el COVID se puede prevenir mediante la vacunación. Las pruebas son otra herramienta crítica para frenar la propagación del virus y sus variantes. Y como el gobernador mencionó, el Estado está ampliando los días y las horas de nuestros sitios de pruebas basadas en la comunidad en todo el Estado. Aunque las pruebas son fundamentales, las pruebas son de detección, no de protección. Para protegerse, vacúnese y reciba un refuerzo. Si no lo hace para protegerse de la hospitalización y la muerte, hágalo para proteger a sus seres queridos. Hágalo como una señal de respeto por los hombres y mujeres de nuestros hospitales y de nuestros sistemas de salud que están abrumadas. y agotados. La conclusión, muy simple, vacunarse, reforzarse, hacerse las pruebas y mantengan sus máscaras. Muchísimas gracias. And with that, I will turn it on to Mr. Alan Spooner.
Thank you, Dr. Izzy. Hello, everyone. I want to give you a bit of our current situation, just to give you a flavor of what's going on in probably most of our hospitals and healthcare systems across the state. An increasing number of patients are presenting to the emergency department experiencing COVID-19 symptoms. Consequently, over the past 3 weeks, COVID-19 cases have grown 4 times, from 10% of our inpatient census to 42% of all of our patients. And more than 70% of our critical care patients are COVID-19 patients, with unfortunately 30% of them requiring a ventilator. Surgeons and specialists have expressed concerns that ongoing delay of procedures and care is increasing the severity of patients' medical conditions, and that the pull of acute care personnel and other resources is delaying serious non-COVID-19 patient care. COVID-19's prevalence in the south suburbs is anticipated to affect significant numbers of our employees. Physician and staff infections have risen as this latest surge increases, exacerbating an already precarious staffing shortage across healthcare. So what do we do about it? Get vaccinated and get boosted. All hospitals continue to face difficulties with overwhelming spread of COVID-19. Please remember that the greatest gift that you can give your loved ones is to get vaccinated and boosted. It protects others, including the resilient healthcare heroes throughout this great state, and reduces the likelihood of hospitalization. I'd like to thank all healthcare workers serving our communities during this pandemic, and I'd like to give a special thanks to our Franciscan health physician and staff. Throughout this pandemic, you have shown courage in caring for COVID-19 patients when not much was known about this disease, and flexibility as the healthcare staffing crisis lowers the number of those serving at the time you need them the most. I ask everyone, please get vaccinated, boosted, and wear a mask to protect your loved ones and our healthcare workers who have already sacrificed so much over the past 2 years caring for our neighbors, friends, and family. Thank you.
Thank you very much, Alan. Thank you. And now I'd like to introduce the President and CEO of Southern Illinois Health, Rex Budde, who will be speaking remotely with us. And I want to just say a special thank you to him. SIU Health has been just a tremendous partner to the state. They are dealing with the pandemic in a way that's somewhat different than other places in the state. And I just am grateful for the advice and for the help that Rex Budde has given to us, to IDPH, and of course to all the people that they've treated. So, Rex.
Thank you, Governor. Yeah, I appreciate the opportunity to have a brief conversation with everybody. No big surprise, we're seeing the same sorts of things in Southern Illinois. Fully 40% of our medical beds are occupied with COVID patients. We're at 54 patients this morning. We treated or tested 450 patients over the weekend and are booked the rest of the week in trying to test people. So we're really up against it. Finding the staff to open more testing sites is a critical need, but my conversations with the governor and others at the state, they're doing everything they can to help us down here. I would echo a couple of things that have been said already. Get vaccinated. People are dying from this virus that don't need to die. Imagine being a nurse or a physician or a care tech. You have to look at this and deal with this every single day. The staff is worn out. Nurses are worn out. Physicians are worn out. We've been at this for almost 2 years now. The number one thing that we can do is get vaccinated. We have had to delay heart care patients. It's been harder to care for stroke patients because we've had to devote so many resources to COVID. So please, if you haven't been touched by COVID, if you wait long enough, you will. Get vaccinated, wear your mask. Do this not only for yourself, but for your loved ones, for the caregivers in your region. It'll make a big difference. And I do sincerely appreciate what my nurses, my physicians have been through. And I can't speak kindly enough with all the support that we've gotten from the state. So thank you very much, and please get vaccinated.
Thank you very much, Rex. And now I'd like to introduce Colleen Kennedy, the CEO of Carl Broman Medical Center in Bloomington and Carl Eureka, and she'll also be speaking with us remotely. Colleen?
Thank you, Governor Pritzker. The COVID pandemic has me thinking a lot about the word community. I've lived here in Central Illinois for just over 11 years, and the appeal of Central Illinois to me is the patchwork of our small towns and our mid-sized cities is our residents. We are hardworking, honest, family-oriented people who know the value of sacrifice and teamwork when it comes to helping a neighbor or supporting a local business. Our resilient communities know their strength in numbers when faced with a challenging situation, and I believe this sense of community is what is needed now to end the surge that we're seeing with this COVID pandemic. Carle Health joins other hospitals in our region and across the state who are experiencing a very concerning surge right now in COVID hospitalizations. And this rapid increase that we're seeing is certainly impacting our capacity and our resources to be able to care for our communities. The majority of our COVID patients that are especially in our critical care areas are unvaccinated. And I want to say to you quite simply that I worry right now that our pleas to our communities and asking everyone to get vaccinated have become white noise and are actually causing some to bristle at the words, and that's certainly not what's intended. This pandemic continues to be very difficult and challenging for our healthcare professionals and for those that are on the front lines. It's very real to our staff, as you've heard from Rex, who are living it every single day. I want to share with you that I was rounding in our ICU recently, and I asked one of our intensivists, one of our physicians in the ICU, how are you doing today? And he looked at me very down and distraught and very defeated. And he said simply to me, I am so tired with people needlessly dying. It doesn't have to be this way, and it's tearing apart families. Just last week, I was rounding in our intensive care unit, talking with one of our most seasoned nurses. She shared with me that they were in the process of going to intubate their third patient for the day, and she had tears in her eyes as she described to me a situation, the heartbreaking event really that had occurred earlier in the day. She shared that she had a patient that was in her 40s, was COVID positive, and they were just about to put the patient on the ventilator. And as they always do, they were coordinating a FaceTime call with her family. And so she said that this was likely going to be the last conversation this lady would have with her family. And our staff member actually had to walk out of the room because she said the scene was unbelievable as this beautiful family appeared on the screen, a husband and two beautiful children sitting in front of their Christmas tree, having a conversation to say goodbye to their mother. Sadly, this type of story is not uncommon in any of our hospitals right now. I want to close with one final thought. I've heard many people say that they're healthy and they don't need to get vaccinated because they don't think if they got COVID, they would get very sick. I want to ask you at this time to please think of your neighbor. What if you had a child or a grandchild at home that wasn't old enough to get vaccinated and was being treated for cancer or some other type of disease that you knew if they got COVID, they would likely not do well? If this were your child, would you rethink and would you get vaccinated? So I challenge you right now, please think of your neighbors because this could be their child. We have the opportunity right now to unite together to protect our neighbors and our communities. And I think together we can end this pandemic. So at this time, I'd like to welcome back to the podium Governor Pritzker.
Thank you. And before I take questions, I just want to say that Colleen Kennedy and the folks at Carle similarly have been our partners all along in this pandemic, fighting hard to keep people alive. Carle covers much of central Illinois. People really need their hospitals and the people that work at those hospitals. And I'm very, very grateful just personally for all that they've put in over the last, well, I guess we're at almost 2 years now. And so I plea with all of you, as Colleen has, to do the right thing, get boosted, get vaccinated, wear your mask, keep people safe. So thank you, and happy to take any questions from Tamat.
Governor, can we talk about New Year's Eve? Parties are still a go, vaccine mandates are optional. Did you consider restrictions?
Well, what we've done is to make sure that people know that getting vaccinated, getting boosted, and wearing your mask is the best thing that you can do to keep yourself safe. People obviously should take extra care. You heard Dr. Izzy talk about the fact that people who are, getting together and think that everything is safe, everybody can take their masks off. Omicron and Delta are coming to your party. So you need to think twice about how many people will be gathered together, keeping social distancing if you're at a party, and if you can't, leave.
Governor, the General Assembly begins. Question: what are your priorities going into this next? And second part of that is how are those priorities going to be implemented?
Well, let me take the second part first. I have spoken with the leaders. We're all watching these numbers carefully. As you know, we've had to take extra precautions for the legislature when things have gotten very bad within COVID. And so I'm watching it as they are for, how many days will they actually be in person, in session. They both have remote committee meetings available, which is much of what happens in the early part of a legislative session. So I imagine that they'll be using that. In terms of my priorities, I have one priority every session that is the number one priority, and that's balancing our budget, making sure that we're doing the right thing to put our state in, on firm fiscal footing, to continue to get credit upgrades as we have, and to make sure that we're providing the services that people need.
Governor, good afternoon.
Sorry, I just want to, apologize. I just saw him first. Yes, sir.
Governor, will you be watching? Are there any statewide?
Well, I think I've told you what those are, right? That we're providing more and more testing, more and more boosters, more and more vaccine clinics across the state. That's what we're doing to make sure that we keep people safe. I want to call on local leaders to do the right thing for their communities, just like Mayor Lightfoot did, just like President Preckwinkle did. They looked at their communities and said, this is the right thing in my local area. I hope that people across the state will take example and look at what will work in their community, because just saying that you're going to look at vaccine cards may not work in one place or another. And so you've got to know your community and get it right in your community. But please, 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 if you're going indoors, obviously we know what the exceptions are with bars and restaurants, but if you're going indoors and you're going to congregate with a bunch of people, please, please wear your mask. We're one of the few states in the country that put it on in early August and has kept it on, and it really has kept infections from skyrocketing. It's awful right now. But it would be much worse. Look at the states around us and how many people are getting sick and going into the hospital and dying.
Governor, I have a test. Obviously, we all know demand for tests is much higher than what. So the expansion that you've discussed at the community sites, do you anticipate that this is enough to fill the gap? And I guess the second part of that question is, you were on a phone call with the president earlier. Was there any discussion about what the federal government can do just in this regard, besides what they've already addressed in terms of addressing especially the shortage of at-home experience?
Well, I'm proud to say that we're very experienced in the state of Illinois at expanding testing, making sure that we get, tens of thousands, hundreds of thousands of people tested. We've been, doing that since early on in the pandemic, that is building out our testing capability. And so we have turned that back on and backed off whenever necessary. It is important now that we have those tests available to everybody. So it is, we've made them more available than they were before. We're continuing to do that. We'll continue to provide mobile sites so people who can't get out of their neighborhoods necessarily to go get a test can find one in their neighborhood. That's much of what we're doing on the testing front in the state of Illinois, but we're pretty good at it, and we have, in fact, been expanding it all along. To your other point, the president did talk about, of course, the 500 million tests that are going to be available to people all across the country. Some of us governors have said privately or publicly that it's not enough. Because if there are 300 million Americans, more 330 million or so Americans, and even if you said only half will test, that's not very many tests. And we know that in many work circumstances, it is important for people to test repeatedly. And so what he's providing, what the president is providing, which I very much appreciate, are rapid tests. And that is something that is very convenient for people to have at home. We, of course, are also doing both rapid and PCR testing across the state at the state level. Some of the other governors weighed in with that as well, asking the federal government not to interfere with the good work that's being done at the state level, but to augment it. And I do think that's what the federal government is doing.
And just a second question, again, Vaccination Clinic. Has there been any thought to reopening some mass vac sites across the state for boosters? For example, just from personal experience and discussing with others, that, when you call CVS or Walgreens or trying to schedule an event, you're having to book 2 weeks out. And so we're telling people that there are no. So is it time to open these mass vac sites across the state to give more options?
Well, rather than go to what you're referring to as mass vaccination sites, we're doing hundreds of smaller sites all across the state, and assisting local health departments, which had been providing a certain level of vaccinations with staffing that allows them to do even more. So whatever you want to call it, we could call them all mass vaccination sites. But from my perspective, what we're doing is expanding by tens of thousands the ability for people to go get boosters and get vaccinated during this time when there is high demand.
Dr. Izzy, what's the latest science on the in-home test? If I take an in-home test, will it detect Omicron? And if I still have symptoms, but I test negative, what should I do?
That's a really important question. So we do know that there are some tests, and I can't recount all the names, that there are some commercially available tests that won't detect Omicron. But we have to remember that those rapid antigen tests, they're not 100%. So if you have symptoms and have a negative test, I would still be very cautious, probably stand down, for sure wear a quality mask while you get maybe the PCR test, which you can get at the community-based testing sites, to confirm. But remembering that, if someone is saying, hey, I'm going to get tests because I'm going to go hang out with this group of family friends for the weekend, that test, even if it was accurate and it's negative, is only speaking for that day. And so unless you are testing every single day with the rapid test, you can't continue. You could be negative today but have COVID the next day. And so making sure you're aware of that, it just shares with you what that test means and what it doesn't mean. And definitely if you're symptomatic and you get a negative COVID test and there's reason for you to think that you've been exposed to COVID, which essentially everybody has, then you might want to confirm that either with another test or also getting a PCR test. The positive test for COVID? So anyone who is doing testing, again, not the home test, so there are a large number of additional tests that are not recorded in our numbers. People who are doing in-home tests, those do not get reported through any portal. But any testing site, our community-based testing sites, the tests that are happening at hospitals, at clinics, all of those they're required to send in both positive and negative tests so that we understand how many total tests were done, whether negative or positive, and then, obviously we're counting the positives out of all of those tests that were done from all the sites, but no private home tests are recorded in that.
Doctor, I ask you, when it comes to Omicron, there seems to be a bit of, how soon should you test after you believe those, because I believe Omicron develops quicker, right? So people test 3 to 4 days after. Now, should they be tested the next day, 2 days later?
Yeah, so again, this is all evolving science. As uncomfortable as that might make people, again, let's remember that this variant got put on the variant of concern list not even a month ago. I think it was November 28th. So this is something that we are trying to learn. The previous guidance did say testing after a possible exposure, test 3 to 5 days. We might be learning that the time of incubation might be a little shorter, so maybe you'd be testing at 2 days. Obviously, if you're symptomatic, you test right away. But if you want to test at 2 days, but that negative test at 2 days should not make you think, oh, good, I'm clear. You might want to test again. And of course, symptoms you cannot ignore. Scratchy throat, headaches, all kinds of symptoms. Anything new can be a symptom of this new illness. So we have seen that in some other states very clearly. We're still looking at our numbers. I have anecdotally talked to many pediatricians who are heads of departments at hospitals who are seeing that there is an increase. So we are going to continue to follow those numbers. There's not that many pediatric hospitals that can especially manage a very critically ill pediatric patient. So if that bears out, we want to get that information and we want people to be very aware of that. I don't want to sound the alarm, but we have anecdotally heard and we're seeing a mild increase, but we expect an increase because we are seeing, even though there's not a direct proportion now, the same proportion between cases and hospitalizations, we know as the cases have increased, the hospitalizations have definitely increased. We're averaging about 500 new COVID admits a day. And so as it increases in adults, it's absolutely going to increase in kids. So by that, you can say, yes, the numbers are up, but is it where we are running out of pediatric hospital beds? We're not getting that. But of course, that would be a natural assumption that we're going to continue to see more people. Hopefully, it won't be so severe. We don't want to report any more deaths, period. And of course, those pediatric deaths are especially hard to deal with. So again, the plan and the remedy to that is all the same. Mask up, get vaccinated, get boosted, get tested.
Doctor, one last question with regards. There are a lot of people that are planning to go ahead with these. Doing that, or unvaccinated.
Right. So again, people are going to do what they want to do. Like there's a gradation of safety. Obviously, you are safer if you're not in that large crowded gathering. That's probably the safest. The next thing would be that if you're going to go to a gathering, that there are not as many people. The next thing is that if you're going to be in a gathering, there are a lot of people, that you keep your mask on the entire time and you put on a high quality mask. That absolutely can be very helpful if people are wearing masks. And then when you have to take it off to eat or drink, keep some distance from other people so that you're not swapping air with people right in your face that may be wanting to share a gift that you don't want. So there are definite harm reduction strategies, if you will, that can be employed. But I know I've seen that people think that once they go to the party, the masks have to go away, and that's absolutely the wrong strategy. Enjoy your New Year's party. If you're absolutely going to have it, wear your mask. Next year, for 2023, you can have your, maskless face. For this year, let's do New Year's more, with our masks.
Dr. Izzy, as far as hospitalizations, do you have any kind of sense as far as how ill vaccinated patients gotten the booster are? That's their been, or even
So again, I know that we're talking a lot about Omicron. As we are doing sequencing, we're not seeing that everything is Omicron. We still have a lot of Delta, especially central Illinois, other parts outside of the Chicago, Collier County areas. Yeah, so in general, we are seeing illness. We have had illness and hospitalization that is due to Omicron, but I know that the reports are saying that it's less severe. Maybe that is true for the masses. Again, we are new to this. We've had this in our state probably only reported for the last couple of weeks. So we need more data. I don't think you can make definitive statements based on just a handful of people. You need a little bit more data. But we don't want to take any chances. We don't want to gamble, no Russian roulette. Let's try to prevent the hospitalization in the first place, whether it's a mild one or a severe one. I think we would all prefer to prevent that hospitalization in the first place. Yeah, so again, there's no change in what we are talking about in terms of who is at risk. People over the age of 65, that's, it's a risk factor that you can't adjust, right? People older age, people who have heart disease, that can be hypertension, that could be CHF, congestive heart failure, people who have liver disease, kidney disease. The immunocompromised are especially at risk because the vaccines may not even have the expected results. So immunocompromised, whether that means that you take high-dose steroids on a daily basis versus other medicines for rheumatologic illnesses or other immune-compromised conditions that further affect your immune system. We also have obesity. We have, I said kidney disease, recent cancer patients, recent transplant patients. I think sickle cell disease, uncontrolled HIV. So there's really a large, any of these comorbidities put you at increased risk. Is diabetes on that list? I'm sorry, I did not mention diabetes, and it absolutely is on that list. Diabetes is almost a form of being immunocompromised when diabetes is not well controlled. So please add diabetes to that list. Thank you.
Yeah, so first of all, we have a staffing contract with outside provider. And so we allow hospitals to use our state staffing contract in order to access staff that they may need, nurses, physician assistants, and others. And again, the shortages that exist all over the country, they exist here too. And so we're doing our best to make sure that we give every access to our hospitals to make sure they get the staffing that they need. That's one place. The federal government also has some Army staffing, medical staff that they can provide. We have not received any of those here in the state of Illinois yet, but they are in other states, and we have made requests for that. So those are just examples. And then I would say Dr. Izzy will tell you about IDPH staff who are augmenting the work of local public health departments, especially during this surge, to help them with both testing and with vaccinations. Great, thank you, everyone. Merry Christmas, happy holidays to everyone.